loud. Awesome. Now we are recording. See, I could have just missed that. So,
okay.
Hello, Dr. Moss, and thank you for being here with me, with Digestive Reset brand, and with all our clients. We're sharing amazing information. So happy you're joining us. Welcome to Digestive Reset.
Well, thank you for having me. It's a pleasure and an honor.
Awesome. Dr. Moss, you're a great health and wellness educator. You're a scientist, retired dentist, founder of a supplement company, Moss Nutrition. You began writing Moss Nutrition Report based on cutting-edge issues in the practice of nutritional medicine. You still have a small practice where you assist chronically ill patients in addressing quality of life. You're also a certified nutritional specialist and a diplomate of the American Clinical Board of Nutrition. What interests me the most is your passion for nutritional medicine, and I pay close attention to it working with my chronic digestive clients. Please tell me more, your background. What can you tell me about your journey in science until now?
Well, I started out in dentistry and graduated from University of Michigan Dental School in '74, and went back to my hometown of Grand Rapids. And for the first 5 years, I was just kind of a routine, conventional dentist, just doing regular dental work, drill and fill, as they call it in the trade. And I started working about '78, '79. I started seeing more chronic pain patients, people with TMJ problems. And I started treating it the way I was taught, the conventional way, which is very mechanical, bite plates and bite adjustments and things like that. And I found that the results in terms of pain control, pain resolution were moderate at best. And I really felt that I was missing something very big. And so I started in 1979, I started taking classes in something called dental kinesiology. And it was really alternative medicine for dentists. And I started learning about all kinds of alternative therapies, homeopathy, chiropractic. Of course, I was taught that acupuncturists, chiropractors were all quacks. You know, we're talking about dental school in the '70s now.
Oh, yeah.
In Michigan. And so I started learning about all of these fascinating interventions and therapies, but in particular, I started learning about clinical nutrition and supplementation, all of which I found fascinating, and started working with clinical nutrition. Started referring out to practitioners who had experience in other interventions, acupuncture, chiropractic in particular, and started getting much better results. And I found it very exciting. And in particular, I was interested in the clinical nutrition aspect of it and really wanted to create a alternative kind of holistic practice. There was only one problem. In Grand Rapids, Michigan in the early '80s, while people may have appreciated what I had to offer, they weren't particularly interested in paying for what I had to offer. So in about '84, '85, I was kind of at a crossroads, just from a financial standpoint. I was going to have to really go back to full-time traditional dentistry or pursue my passion. And I decided to pursue my passion. So I sold my practice and became a sales representative for one of the major professional supplement companies. And they had a position for a salesperson out east, so I moved out east to Western Massachusetts. I was working for that company for about 5 years, and then I left there and started Moss Nutrition as a distribution company selling other people's products, and did that. How long did we do that? Until about 2007, 2008. And I really wasn't finding that I was selling the kind of products I wanted to sell. And and also because virtually everything I was selling was now on the internet. There were financial issues going on. So in 2008, we decided to start our own product line. And we transitioned more and more to our own product line, the Moss Nutrition product line. And as of about 2 years ago, with a few exceptions, that's our main focus right now is the Moss Nutrition line. And we started one product in 2008, and now we have over 100 products and more coming.
That's so fantastic. And I have so much respect for people that follow their passion. It's really, yes, it's still a medical field, but it is kind of different. Nutritional medicine is not exactly dentistry. What you learn, what you paid money for, the education to become a dentist. So yes, a lot of people, they hold on to the education and a profession that they worked so hard for, and they're afraid to make that step and to do what they love. So I'm there with you. And I totally respect. Is there anything personal that's connecting you to that interest in nutritional medicine? What was there anything in the family, or how did you fall in love with nutritional medicine?
Well, certainly my main interest was patients, and I still maintain a small nutrition practice, even though I haven't been in full-time practice since I left dentistry. So that was one of my biggest interests in basically improving the health of my fellow man. It's kind of where I feel I'm on the planet, so to speak. But certainly, having been raised in a very traditional 1950s environment, in the usual standard American diet, I developed my share of health issues, pretty severe allergies for the most part, seasonal allergies, and shots and pills for years with really no results whatsoever. So I was certainly highly motivated for my personal issues. And while it took some time in trying different types of modalities and different supplements, I think I've tried just about every intervention you could try, gallbladder flushes and retention enemas, certainly supplementation, different diets. And I found what worked, and I'm doing much better. I haven't had any allergy problems. Goodness, close to 15, 20 years now. And I grew up with them all my life. The summer times were just horrific for me. And now barely a problem. Beautiful. So yes, I was certainly motivated by my own issues. But quite frankly, again, my issue, my fascination with improving health, and my personal fascination, academic fascination with nutritional research. I'm a real avid reader of research, an avid writer about research. I teach at University of Bridgeport, their Nutrition Institute program, their assessment class in vitamins and minerals. So I really have a very strong personal and professional interest in the science of nutrition.
Beautiful. Yes, I was just talking to another expert in sugar addiction right before you, and we discussed how we get to be so much better as experts, not just by education, not that you're certified and you do nutrition or you love nutritional medicine, but also because you've tried things for yourself, because something you had, like your allergies, and you wanted to take care of it in the most natural way. I think the one that will actually go through the experience will become so much of an expert, much better of an expert than just learning the theory of it. So I'm a big believer in investing into quality supplements. I totally trust your company, and I'm really thrilled we're working together. Do you agree that it's important to get quality sources to manufacture supplements and stay away from fillers and preservatives? Because, for years and years, for decades, pharmacists have been trained that there's no difference as long as there's an active ingredient that's the same. Mm-hmm. It will, pharmacologically, the mechanism of action is the same. It will not make a difference. So tell me what your take on it is.
Well, the point you bring up is actually more complicated than you might think. Okay. Because there is certainly some concerns about quality, but there are, I would say, many urban legends, false assumptions based on not so much the criticisms of the people who do not believe in what we do, the allopathic medicine community for the most part, but there is a lot of misinformation put out by the supplement companies themselves. Sometimes I think there's a lot more good marketing than good science. So while I certainly have, I think, justifiable criticism of our traditional critics, again, the quackbusters, if you will, the traditional medical community, I have equal criticism for people in our industry. So let me be more specific in terms of the points that you're talking about. Quality, every company will say they believe in and emphasize quality control. But what exactly is quality control? Well, very often it's a balance between optimal efficacy, optimal purity, and cost considerations. And it is a balance, no question about it. That every company, every manufacturer really has to find out what they can do and what they can afford and what will allow them to sleep at night knowing they've done the right thing. All right, so let me get to specifics. First of all, quality. The FDA creates guidelines for what determines quality, how to test for it. Basically, what we're looking for, what I think the public wants, is they want what's on the label to be there, number one, and nothing that's in the label, that's not on the label, to be there, whether it be an impurity or anything else. If we have a vitamin C product, you don't want any broccoli in there. Even though broccoli is good for you, we don't want any traces of broccoli in our product. So whatever it is, whether it's a toxin, you want the label to be accurate. And there are certain procedures called the GMPs, good manufacturing practices, that are set forth by the FDA. And there's steps that you do from the testing of the raw material when it comes into the what they call a manufacturer. Some companies have their own manufacturing plant where they buy the raw materials and then put them together in a capsule or a tablet or whatever. And other companies like ours, we work through what are known as contract manufacturers, where we have manufacturers who buy the raw materials and put it together based on our specifications. So we tell our contract manufacturers, we want this raw material from this company, and we want it put together in this manner. So it's our formulas, and we basically state who the manufacturer is. So that gets to a big controversy. Mm-hmm. What's the reality? The reality of the raw materials is no supplement company actually makes their own raw materials. Nobody makes vitamin C. Whatever company is on the label, they aren't making their vitamin C. They buy it from somewhere. Now,
wow, that's something everyone has to hear.
Yes, very important. You buy the raw materials. Now, where do most of the raw materials come from? And this is kind of like a four-letter word in the industry, but we have to talk reality here. Most of it comes from China. And people say, oh my God, China. And people say, do you have anything from China? I say, yes, we do. Well, isn't that a problem? And I say, want to know something? I am really suspicious of things coming out of China. But you want to know something? I'm suspicious of anything that comes from anywhere in the world. I don't trust anybody. There's poorly made product being made in the United States, in Europe. And that's where testing comes into place. I assume that it's going to be poor quality and contaminated until proven otherwise. So China is no better or no worse, even though there's a lot of press about China. There's plenty of poor quality substances coming out from all over the world.
Absolutely.
The testing is absolutely critical. So you have the testing of the raw materials. Routinely, we're seeing that number one is what they say on the label accurate. Are there any impurities? They do what is known as microbiologic testing, bacteria, yeast, etc., and heavy metals are all checked for. This is mandated by the FDA. In terms of other impurities, they'll run what is known as an HPLC. And when you run a material, it'll come like a graph, if you will. You're looking at these certain peaks. And you're saying your vitamin C, there'll be a certain, I guess, a signature, if you will, a biochemical signature. And if they see an abnormal peak that's not supposed to be there, they don't necessarily find out what the peak is, but it's rejected. It has to conform to that particular signature of the material, which they know in advance. Then they go through putting it together, and there's various steps along the way where they have measure it, make sure it's accurate, and then they have post-production testing. Again, same type of thing. They're going to check for microbiology, they're going to check for heavy metals, they're going to check for any unusual peaks, and of course, is the label accurate? Now, that costs money. Does every company follow all the GMPs? The way you find out is you ask them you have on file all batch records. They call the testing they've done along the way, from the initial certificate of analysis and spec sheet all the way up to post-production testing. If they basically willingly say, yeah, sure, we have that, we'll be glad to share information with you, you've got a good company. You usually have to go by nonverbals. If they basically say, sure, we can get that for you, you may want to do some investigation. The quality companies, don't hesitate for a minute, say we're glad to share it with you, and we're proud of it. So that's how you can tell. So that's really the issue of quality control. Now, the next issue you bring up of fillers, binders, things like that. There's a lot of misinformation on this issue also. Supplements, whether people like it or not, are processed foods. You're basically taking something that in the natural state rots in about a week, and you're trying to give it a 2-year shelf life. You have to do something to that to get that shelf life. I know there's companies who say they give the impression that they pick it off, they go to the bush in the field, pick it off, grind it up, and put it in a tablet machine or a capsule machine. I can tell you that is absolutely incorrect, no matter what their marketing says. Because you wouldn't get a 2-year shelf life. They have to do something to it. All right, what do they have to do? Number one, you have to have certain types, or what are known as excipients or flowing agents. These things are all mixed in stainless steel vats. The capsuling or tableting machines are all stainless steel. And when you make cookies, of course, you have your cookie sheet, and you have to use something so that it won't stick, so it'll flow. And so usually it has to be some sort of fat-based substance, a flowing agent, which is usually in the industry magnesium stearate, vegetable stearate, retinol palmitate, some type of fat. Palmitic acid is a fat. So virtually all companies are going to have to use something like that to make sure that it doesn't stick to the machine and it flows evenly. And I know there's been a lot of negative press on this. There's very extraordinarily small amounts of this in the average product. And there's really no legitimate research that suggests that the quantities that are in the supplements will have any impact on health. Now, if you take enough of it, and that's what often people point to research where rats have given massive amounts, of course you'll get sick. And my reply to that is too much of anything. Too much water will make you sick. So it's quantity. Too much of anything will make you sick. Just to say, well, here's research that shows we gave some rats half their diet of magnesium stearate and they got sick. Well, that doesn't really say anything. You have to look at the quantity. So yes, there are going to be flowing agents in there. And one of the things but the other issue is fillers that you mentioned. Now, the reason that most companies have to use a filler is because, particularly if it's a capsulized product, you're going to have to, there's standard capsule sizes. And like vitamin D, for example, you're going to have 400 IUs of vitamin D. Well, even the smallest capsule, it only takes up a small amount of space. You have to fill it with something. And so typically, the best fillers are going to be like cellulose, microcrystalline cellulose. But there are cheaper versions out there available, and this is something you do have to look at. There are some cheap fillers that are used. One you see occasionally, actually it's in the news right now, is talc. With Johnson & Johnson, it's in the news right now.
This is
And
scary.
Some companies, mainly in the retail market, you won't see this in the professional market, but sometimes they will use talc as a filler, and you want to avoid that company completely. Some are using rice powder, rice flour. The challenge there is most of the supplemental rice in the world has significant levels of arsenic. It has to do with the rice paddies where it's grown. It tends to concentrate arsenic. So if they're using rice powder, you want to basically ask them for their arsenic assay. Make sure that many of them are, but not all of the rice sources are tainted with arsenic, so you'd want to get the testing. Cellulose has come across pretty clean. Now, people are making tablets. You have to use something to get it to stick together. Because if you don't put something in that makes it stick, like in your cookies, for example, you don't want your cookies to crumble, so you put eggs in there, and it keeps it together. Same thing when you're making a tablet. Some companies will use honey, molasses, other types of things, and this is something you want to be aware of. But they must use something so that it will stick together, and when they ship it to you, after shipping, you don't want to have a bottle of crumbs. So you have to have the tablets stick together. This is why many companies use capsules like we do. We have a couple of tableted products, mainly capsules, so we don't have to use those types of additives. So those are some of the realities of flowing agents, additives. And the bottom line is, which I tell people, if you want a product that is absolutely additive-free, go to the farmer's market. That's where you'll find it. These are processed foods, whether you like it or not.
That is such a important information for anyone. People are so clueless when it comes to supplements and what they're putting into their bodies. And I've had people telling me that they're taking 50, 60 capsules, 70 capsules of different, like, the variations of supplements, and I'm concerned. They think they're doing something great. All I'm thinking is, oh gosh, what's going on with the liver of that person?
You're very well said. That's a very good point. Is the question of what to take, how to take it. There's so much information, particularly on the internet, misinformation, that suggests that these are panaceas. And I understand people don't feel good, they're frustrated, they've gone to other doctors, and I understand the emotions that come into play that can sometimes cloud thinking, and I really sympathize. But simply just loading up on pills based on vague platitudes, promises of panacea on the internet, and people are trying to sell things, we can run into a major problem of people just over supplementing. And yes, these supplements, when you take enough of anything, it can create potential metabolic imbalances.
Exactly.
Your point is well made.
Yeah, for sure. And I'm like the health detective. I first want to take them off of everything before I start recommending the things to a minimum. That's what things that they truly really need. That's the key.
Right.
So,
and one other issue I want to bring up on this, very important, which we're seeing now, when I'm really trying to make the public aware of this, and certainly our clients, a vast majority of the supplement buying public is now taking pharmaceuticals of some type, either prescription or over the counter. And this issue of nutrient, drug, herb interactions is massive. And what's challenging, particularly for a company like us, when you go to the trouble to make a very high quality, very bioactive product, it's a double-edged sword. A good quality product has great potential for doing something good when used correctly. However, a very metabolically active product has great potential for causing problems if you are not aware of drug interactions and you are not fully making yourself aware and looking into the potential interactions with drugs. Give you an example. many drugs, for many illnesses that drugs treat are inflammation-based. Let's take high blood pressure, for example. Most high blood pressure is related to some type of inflammatory process. And so you take a hypertensive, and you take your blood pressure down to a normal 120/80. Now, let's say you take something like curcumin, which further reduces inflammation. You potentiate the drug, it could drop too low. Or conversely, because we know that curcumin is very effective in altering detoxification pathways, you can alter the metabolism of the drug, reducing its effect, and your blood pressure will skyrocket. And I've seen it happen. So this is a massive, massive issue that people need to be aware of. You don't just start taking supplements if you're taking pharmaceuticals. You need to get the information or go to a knowledgeable healthcare professional who can guide you.
Thank you so much for bringing that up. I didn't even ask you to do that, but you just promoted me. Because honestly, the doctors, they know their stuff, and we respect them for understanding the medications. Pharmacists know their medications really, really well. You have to be really smart to finish pharmacy school, trust me. But there's no one like myself in the middle, maybe a few people. People that understand the pharmaceuticals and understand the nutraceuticals, and will have that filter to be able to clinically assess whether there is a drug interaction, whether there is a contraindication, whether, like licorice root, for example, you don't even need to have a metabolism issue. It will simply raise the blood pressure for someone that, for most people with blood pressure or normal. So yes, you do need someone really qualified that understands both if you are taking pharmaceuticals. And we already discussed those that are taking a lot and not on any pharmaceuticals could also get into trouble. So thank you. I've been trying to bring this message out for the past 10 years. I've applied to certain, I've tried to let the big people know. Maybe one day our message will come across.
We're working at it.
Let's talk about alkalinity. That's something our clients are asking nonstop. They're very confused. What does it mean when we say the body is healthier in the alkaline state? What do we trust, the urine test or another alkalinity test? What supplements are necessary if there is an alkalinity issue? Tell us more.
Sure. Should we be more alkaline? Let's start out with that question. There is some increasingly reliable research that suggests yes, particularly if we're proponents of the Paleolithic approach nutrition, which basically says that we have the metabolism of the hunter-gatherer who lived 30, 40,000 years ago, and our metabolism has not changed that much. So the idea that our lifestyle and our diet should conform to the diet they had will put us in the healthiest state. And their diet was very high in alkalinizing foods. They had a very high plant-based diet. Now, did they eat meat or did they eat animal protein? Yes, they did. However, they didn't just eat the muscle like we do. They ate the whole animal. They ate everything. Nothing went to waste. And different organs have different pH balances, acid-alkaline balances. Muscle tends to be what we eat now. The muscle tends to be more acid, but other organs balance that out. And so the bottom line is they were eating a high alkaline diet. The most recent work that really influenced me was the work of 3 researchers who published some fascinating papers who looked directly at this issue of the hunter-gatherer. And there's 3 researchers. One of your viewers may be familiar with Loren Cordain. He was really one of the main authors of the Paleolithic approach to diet. He's written several papers in the last 20 years. 2 researchers who I've been following, haven't got quite the publicity, not quite as well known. Linda Frizzetto, and I can't remember the first name, but Dr. Sebastian. These 3 authors have been written some brilliant papers on stating that we need to be primarily and a more metabolically alkaline physiology. And again, they show a massive amount of data relating to the Paleolithic diet, what the hunter-gatherer was eating. And of course, our diets, the standard American diet, is highly acid, not only because of the red meat issue, but more precisely related to the processing of foods. Processed foods are going to tend to have a more acid type situation. That's one aspect of it. But the other aspect that they point out is that the main factor in the diet that makes it alkaline is potassium. And I'm not ready to advocate what they say, but they have literature that shows that the hunter-gatherer was ingesting about 10,000 milligrams of potassium a day. All right, now what does that mean? The RDI, the recommended dietary intake of potassium, is 4,500 milligrams a day. The average American, according to the research, gets about 2.5 to 3,000 milligrams a day of potassium. So even by U.S. RDI standards, the average American is grossly deficient.
Mm-hmm.
Sebastian Cordain and Frazetta are saying we should have twice as much. Mm-hmm. And they present some very compelling data based on the hunter-gatherer, what the hunter-gatherer was eating. Bottom line is, they were eating a tremendous amount of plant food. Now, what's the argument against that? The hunter-gatherer didn't live past 40 years of age, usually. They died young. Would they have done as well on 10,000 milligrams a day in the 60s and 70s? So there are some unanswered questions here, and certainly some controversies. But the bottom line is, the evidence is clear that we need to have a diet that is more alkaline and much higher in potassium. And I feel that this is a message that is just not really getting across, certainly the public, definitely not the medical community, but even the nutritional, functional medicine community. I can't remember the last time I went to a symposium and heard a talk on potassium. I hear plenty on magnesium, and mm-hmm. that's kind of like the other side of the potassium coin. They're both important, but as much as I hear about magnesium, I never hear about potassium. And I really don't know why. Certainly, the vitamin companies don't make a lot of money on it. It's very cheap. That may be a reason. No financial reason to emphasize. I don't know why, but this issue of potassium, according to the research by several authors, is that it's very necessary, and the American diet is grossly deficient. Grossly. The data I saw that the average American, 70–80% of all Americans are getting about 2/3 of the RDI. So that's a real nutritional epidemic.
For sure, and so going on the radar. Hopefully we'll wake up with that. And it's funny that you mentioning potassium. Not funny, actually. There was research. There were companies making it, and there was a multi-level company. I remember we just got to this country. It was 1988 or 89, and my father, with like no education in nutraceuticals, started working for a company called KM. I'm not sure if you're familiar with it.
I remember them.
Right?
Yes,
right?
It was a big fad. You're right, about 30 years ago.
Right, and he didn't know much. He was trained, and he was giving it first to the family and family members, and it was helpful. It was super helpful for those with blood pressure, with just like he tried on. He was giving it to the elderly first. They were like getting the energy back, and I thought I just considered going to pharmacy school. This is quack. What are you doing, Dad? This is impossible.
I was the same way. I didn't believe it. I thought it was all hype and quack. It took me about 20 years to figure out. They were onto something.
They were, and it's just such a shame that they didn't go big. But yeah, I what happens in 20 and 30 years, then you get wiser.
Yes,
you realize
exactly.
things. So talk about the testing, what you think about that.
Sure. All right, testing. Certainly you need to start out by looking at your diet And there's plenty of information out there. They have these nice charts where you can see which foods are more alkaline and which foods are more acid. Now, with that said, we have to say something. Acid is not a four-letter word. It's not a dirty word. You're supposed to have acid-based foods in your diet. It's a matter of balance. So that's what I would emphasize. It doesn't mean you avoid all all animal-based foods and just eat plant-based foods. That's not what I'm saying here. The literature agrees you want balance. That's number one. So take a look at your basic diet. That's certainly the main issue. But in terms of more objective testing to determine your relative acid-alkaline balance, probably the easiest way to do it, and it's far from perfect, is the first morning urine pH. We can get pH strips. Ideally, you like it between 6.4, and different authors say different things. Use about 7.0, 7.2, 7.4 in that range there. Although, as I mentioned, Frazzetto and Sebastian and Cordain like it well into the 7s. But again, still controversial. I think there is agreement between 6.4 and 7.0, 7.2 is where you want it. Now, does the first morning urine pH tell you about what the pH of your body? No, it does not. It basically tells you, according to the research I've seen, is what is the net overnight acid excretion, which is nice to know, but it's not telling you what your systemic pH is. We can extrapolate, we can use it as a tool, and it's nice to know, but that can be misleading. But generally speaking, if someone has a first morning urine pH and it's way low, they measure it in the paper, it doesn't turn color at all, it just stays yellow. The paper, usually when you want it in the range that you want it, the paper would turn like a green or almost a blue color. Tells you where you want to be. If it stays yellow, you're probably too acid. And generally speaking, for most people, that's going to be a dietary issue, but not always. There's other things that can make you too acid. Pharmaceuticals can make you too acid. We keep on going back to that. If you're a serious exerciser, you'll make a lot of lactic acid, and that can make you more acid also. So it's not always a dietary issue, and it's not always a potassium issue also. Generally speaking, for the average American, when they get a pH that's too acid, improving the diet and supplementing with potassium and magnesium is usually the first choice of intervention in terms of how to raise the pH. And again, I emphasize the issue of diet. Now, other ways that you can evaluate this, looking at blood chemistry, blood tests. Certainly looking at the serum potassium is very helpful. The average range for serum potassium is anywhere from 3.5 to 5.5. The research I've seen is that while that's good to tell you if you have pathology, for example, you have gross potassium deficiency and you should be hospitalized, that range is good for that. But what we're looking for as nutritionists is what will create optimal health. And what will create optimal health, we want a very narrow range for potassium. We want it really right in the middle, actually, according to the research I've seen. And if you have any health issues, heart problems, the research says you want to go on the high end, like 4.5, 5.0 in that range there. You want it slightly above the midpoint. Also, things you can look at, there's an analyte called bicarbonate, CO2. And if it's a little low, that will tell you that you're too acid. Certainly looking at other indicators like your fasting glucose. If you're diabetic, the glucose is too high, that would suggest you're more acid also. So there are objective measurements also with blood chemistry that we can take a look at along with the urine strips.
Sounds really good. And again, with the help of a qualified healthcare practitioner, it's not really simple to figure it out on your own, probably.
Right. On your own, just take a look at your diet. And,
yeah, and the strips too. I mean, if you're too acidic, you have a problem.
You'll get pretty good information. It's nice to consult a healthcare professional, knowledgeable professional, but if you just basically take a look at the strips and take a good close look at your diet, and making sure you have optimal balance of quality, whole foods, some acid, some alkaline.
Perfect. Perfect. Thank you. So let's talk a little bit about proteins and amino acids. It's important to consume enough protein / amino acids to maintain healthy weight, because weight, hormones, digestion, all kind of is one thing, and other important functions of the body. What would you recommend for a good protein intake? And is there a number? Is there a formula you go by? What are your recommendations here?
Number one, it needs to be emphasized that, I hate to use the word, but literally right now, there is an avalanche of research on this issue, particularly in the middle-aged and older population.
Right.
I said there's an epidemic of potassium deficiency. There is an epidemic of protein deficiency. And as you get to older individuals, it gets even worse. Why is that? Is because they need more and more. Where we were misled was the standard dietetics approach to optimal protein intake. Now, it's the way they do it, it's measured what they the amount of grams protein per kilogram body weight. Now, what does that mean? The average individual, say, weighs 150 pounds. In kilograms, that's about 70 kilograms, okay? And so let's say you have a 70 kilogram individual. That means you want, based on standard dietetics measurements, you would want probably about 55, 60 grams of protein a day. And that's what the average individual probably gets. But what's the problem? As we age, and this is exacerbated if you're getting sick at any age, you need more. It's interesting how this research was done. They came up with 0.8 grams per kilogram body weight. It was done on some very archaic measurements, but more importantly, this was research that was mainly done on volunteer. The research was done at usually universities, and they got college students to volunteer. So 0.8 grams per kilogram body weight is probably good for 20-year-old healthy individuals. And we just extrapolated over the years. It's also good. If it's good for a 20-year-old, it's also good for a 60-year-old patient with heart disease. Not true. The research is very clear that as we age, and as we get into 60, 70 years of age, compared to the RDA, the standard RDA of 0.8 grams per kilogram body weight, we need about 50% more. And if you're sick, you might need twice as much. And so because we need more than the standard, we have an epidemic of protein deficiency, particularly in the baby boomer population.
Very, very true. Yes, I worked as a consultant in a nursing home for many years. And I've seen that firsthand, and how most of their albumin would show up to be super low, and how it's often unaddressed. And yeah, this is I agree. I agree.
But what is the health impact of this? This is another really important issue.
Right.
Being deficient in protein is considered one of the main reasons that people feel lousy, no matter what the situation. There is an elaborate amount of information that shows, for instance, cancer patients. They get in these wasting syndromes. We've all seen them. They go through chemotherapy and they look terrible. They've lost a lot of weight, and this leads to a massive decrease in quality of life in virtually every aspect of life. Your energy, your ability to do things. In fact, what goes on when you don't have enough protein and you've gone through some of these therapies, that yes, you lose quality of life, but also they have found that your ability to respond to the chemotherapy is compromised, and that you're more likely to have an earlier mortality. So I'm not saying you can cure cancer with protein. What I'm saying, as an adjunct to good quality allopathic medical treatment, it can really help you feel better and improve your ability to respond to treatment and improve mortality, length of life. But the thing that people don't realize is how much low protein affects. We tend to think, well, we lose muscle. Yes, you do. People don't often appreciate what losing muscle means. it's not just your arms and your legs, your skeletal muscle. You breathe because of intercostal muscles, your lung muscles. So you have trouble breathing effectively. And this can lead to pooling of fluids and infections in the lung. Also, we tend to forget that there are certain muscles that we don't talk about in polite conversation. The muscles that control urine, the muscles that control bowel function are lost. And so when people are losing muscle, it's not just the arms and the legs. We're talking about some issues, the very basics of self-respect, the things that we take for granted, people lose that. And so there's a tremendous amount that we can do by helping build muscle with proper protein intake and, of course, optimal exercise. Golden information. We have to get this out there to the maximum amount of people. Tell me a little, as far as my chronic digestive clients and hormonal imbalanced clients, anything you could suggest as Sure.
as a general blanket statement for my people?
Gut problems, chronic gut problems. It appears from all the literature I've looked at and the experts I've talked to, probably the central issue is going to be gut microflora imbalances. There are other issues that come into play, certainly diet, certainly stress, how fast you eat, for example, what you're thinking about what you eat, but it appears that the core issue is imbalances of microflora, either having too little of the good guys, of the good microflora, too many of the microflora that shouldn't be there at all, pathogens, too much of certain organisms that are supposed to be there but in small quantities, such as candida, for example, is the most notable example, or the microorganisms are in the wrong place in your small intestine, what they call SIBO, small intestinal bacterial overgrowth. And so doing quality stool analysis, seeing what's there, and using antimicrobials to bring things back into balance, and then using certain probiotics when necessary. There is a lot of suggestion now that probiotics are massively overused. They do have benefit in terms of helping people feel better, but do they do what the marketers say in terms of radically and permanently altering your microflora in your gut? The evidence is largely no, they don't. So they have their place, but what you're going to do in terms of antimicrobials, dietary changes for the IBS patients, the low FODMAP diet, reducing intake of sweets are going to be much more important, as well as stress reduction, eat slow, that type of thing. So that's the general approach. But the last thing I would say is all of these cases are, particularly people who have a problem for a long period of time, it's highly specific. It's very difficult to generalize. Other than you have a microflora problem, I really advise that after you've tried a certain amount of self-experimentation and it's not working, you've gone on the internet, do consult with a knowledgeable healthcare professional who can basically do the optimal tests, the blood tests, certainly the stool analysis, and put you on a good quality treatment program that includes diet, different types of supplements, and recognizing it has to be done in stages. And generally, if you've had the problem for a while, it's going to take about 6 months to a year.
Yeah.
It does. So the idea that if you had this problem for a while, you're going to go on a low FODMAP diet, a low carbohydrate diet for a month and be cured, you may feel better after a month, but if you go back to your what you were doing, it'll come right back.
Yeah.
And
some people don't give enough time to certain diets. I get things like, oh, I've tried the gluten-free, didn't work for me. How long were you trying it for? Oh, well, a whole week or a whole 2 weeks. You know, that's not enough time. And I appreciate you mentioning stool testing and different types of testing. I've seen clients transform to a completely different person when we go through the stool testing and then sometimes organic acid testing, and after we correct what's going on with the microbiome. And I appreciate that you mentioned about the probiotics and how people also have that common misconception. My doctorate paper was on clinical effectiveness of probiotics in Crohn's and colitis. And although there's a lot of promising data and there's a lot of quality probiotics out there, especially with the new breakthrough ones, there's great research. But just for people to understand, a day of extreme stress, one day, 24 hours of extreme stress, maybe divorce or like people go through severe stress, that changes your microbiome to a completely different microbiome you had yesterday. So you could have corrected your microbiome with a good probiotic, would work with me, for example, and we went through a bunch of testing. We took out the pathogens, we put in the good guys. And if you go through something that overnight, you could have a totally different gut flora. So I really appreciate that you mentioned that. And how can we, it's a question from me, how can we find information about you and your work? I'm sure after all this that you told us, people will be really interested in that.
Sure. Go to our website, mossnutrition.com. And you can learn about the work we're doing, the products that we have. We typically only sell through healthcare professionals. We do sell to the yes, we will sell to the public, but we do, if they don't have a healthcare professional, I do personally, generally speaking, screen them first before we allow them to buy our products. I want to find out at minimum what pharmaceuticals they may be taking, any significant health issues where our products, because they're so bioactive, may be contraindicated.
Yeah, and I carry your products, and I'm really proud, and I know my clients get them very happy with your products. So thank you so much, Dr. Moss, for being with us. It's an incredible amount of valuable information. We all appreciate it, and we hope to see you again for another interview here at digestivereset.com.
Thank you. Thank you for having me, and yes, I look forward to talking again soon.
Awesome.